Thank you all for joining us this morning. My name is Thomas Larson, and I serve as the Director of Public Information and Government Affairs for the Tobacco Settlement Endowment Trust. We're here today to discuss the realities of teen vaping in Oklahoma, the mental and physical health challenges associated with youth vaping, and how TSET and our partners are actively fighting for a healthier future for all Oklahomans. We're excited for you to meet our expert panelists, and here to introduce them is our Executive Director, Julie Bisbee.
And our event. We've gathered together a group of expert panelists who hold deep understandings of the effects that vaping has on teens in Oklahoma. Each panelist brings a unique perspective on the effects of teen vaping and the strategies that we can employ to set our youth up for a future with clean minds and clean lungs. I'll go through and introduce the panelists very quickly. With us, we have Representative Rhonda Baker, who represents District 60, which includes El Reno, Oklahoma City, and Yukon. Prior to being elected to the House of Representatives, Representative Baker was a middle school English teacher who spent nearly 2 decades in the profession. As a member of the House, Representative Baker has developed a reputation as a strong advocate on education issues, serving as the chair of the House Common Education Committee and a member of the House Appropriations and Budget Subcommittee on Education. She has been recognized for her work, including being elected as chair of the Education Committee of the Southern Legislative Conference and receiving the Oklahoma State Regents for Higher Education Distinguished Service Award. Thank you for joining us.
Thank you for having me.
Next, I'll move on to Charlie Gagan with the American Lung Association. Charlie is the Advocacy Director for Texas and Oklahoma for the American Lung Association. Previously, he was with the American Cancer Society Cancer Action Network, and he spent the last 9 years working to empower communities to address the toll of tobacco and cancer. His work focuses on grassroots advocacy, lobbying at the local, state, and federal level. He's led numerous local smoke-free campaigns and helped lead efforts to pass a statewide Tobacco 21 law. Welcome, Charlie. Excellent. Moving on now to Dr. Amy Cohn. Dr. Cohn is an associate professor at the TSET Health Promotion Research Center and with the Department of Pediatrics at the University of Oklahoma College of Medicine. She is an affiliate member of the OU Psychological Research on Information and Media Effects Lab. Her research focuses on tobacco regulatory science, smoking cessation interventions among groups that are disproportionately affected by tobacco use. And the goal of her research is to identify factors that promote or impede positive behavior change so they can be targeted in policy, prevention, intervention efforts to help people not start, prevent escalation of tobacco and other substance abuse, and maximize cessation efforts. Welcome, Dr. Cohn. Moving on to Dr. Erin Vogel. She is an assistant professor in the TSET Health Promotion Research Center and at the Department of Pediatrics at OU Health Science Center. Through experimental and observation qualitative approaches, her research examines social influences on tobacco use and the use of digital tools and social media to address tobacco and other substance use among priority populations. Her current research focuses on the influence of social media on youth tobacco use, youth perceptions of emerging oral nicotine products, and digital tools for reducing problematic substance use. Welcome, Dr. Vogel.
Good morning. Thanks for having me.
Now we'll move on to our youth advocates. We have with us today Lacey Lehman. She is a senior at Keys High School and has been a member of Youth Action for Health Leadership, or YAL, since the program began in 2021. Through her involvement with YAL, Lacey has volunteered over 145 hours of her time creating a healthier Oklahoma. That's impressive. Thank you, Lacey. She is also involved with speech, debate, and cheer at her school. And after graduating high school, she plans to study business. Welcome. Also, we have with us today Landon Lopez, who is a junior at Hennessy High School, and he's been a member of y'all for the past 2 years and has advocated for comprehensive tobacco retail licensing and improved school wellness policies. At Hennessy High School, Landon is a member of the band. He also spends his spare time at an internship with a local clinic and working. Landon hopes to get his bachelor's of science in nursing after high school and become a travel nurse. So great to have you all with us today.
So at TSET, we continually strive to reduce Oklahoma's leading causes of preventable death, tobacco use, and obesity in order to reduce cancer and cardiovascular disease. Our conversation today will provide insights into the effects that vaping has on teens in Oklahoma through a collaborative discussion with these panelists. Unfortunately, the high school vaping rate in Oklahoma is higher than the national average. In fact, 1 in 5 Oklahoma teens vapes on a regular basis, making this a critical and timely conversation to ensure our youth have healthy, nicotine-free futures. We are so glad you have all joined us this morning to listen and learn, but we would also like you to participate. There will be an opportunity for Q&A during this event. If you have a question that you would like answered by one of our panelists, please put it in the chat and we will try to answer as many as we can at the end of our program. And with that, I will turn it back over to Julie to start the questions.
Thanks, Thomas. We're thrilled to have this great discussion happening here today. So as we receive questions in the chat, we're going to go ahead and get started with some pre-submitted questions. Representative Baker, as a legislator and former educator, how do you think the legislature, schools, and organizations such as TSET can work together to effective policies and regulations to address teen vaping in Oklahoma?
Thank you, and that's a great question. I will tell you, as chairman of the Common Education Committee, it is my job to be up to date with the issues that face schools so that we can find potentially policy solutions to help the education needs. And this is an issue that has grown since I've served. In 2016, it's become increasingly a problem for schools. And I think that it's important that the legislature and TSET do work with schools to get out the necessary information to students and parents. I mean, parents are an important component to this as well. But we've got to provide the education needed so that these students are aware of the dangers. Of course, you know, they're going to have the choice, but they do need to be educated on the dangers. And of course, the parents as well. As I said, you know, the schools are facing vaping as an issue, and it has turned into a lot of disciplinary problems for the schools. So they really are hoping that we can come together and provide a solution to help with this problem.
Yeah, really great points. We know when we're out, you know, school administrators are always telling us kids from elementary school on up to high school, finding vapor products with them. Yeah. So in that, I pass it over to either Landon or Lacey to kind of talk about what you see and, you know, what you think could be done, and maybe give us some insights on some of the misconceptions that young people have about vapor products.
Okay, so some of the misconceptions that people have are that teenagers don't understand what's going in their bodies. Like they understand, I don't think that people understand the why, like why teenagers are doing this. And the reason why is to seem cool, like that everybody is doing it and they should too. And it's like now it's even 10 to 13-year-olds that are being targeted and think that it's cool through social media to vape. And people in my middle school, I've seen it in the elementary, middle school vaping products. People, even middle schoolers, they had to put vape detectors in the middle school. So, and one thing that we can do is update policies that regulate vapes and educate teenagers in the community.
Very good. Landon, would you add to that at all?
Yeah. So as Lacey said, many students want to look cool, want to seem cool. But I honestly think that, children or kids my age, they know what goes on in their body, but they're just influenced by the fact that, like, many influencers on social media do vapes or smoke vapes or whatever. And that's something that they want to do. That's something that they're influenced to do, you know? But for my school, we don't really have vape detectors because we're not that bad. But yeah.
Very good. Very good. That's a great segue to some of the research that Dr. Erin Vogel is doing. And I wonder, Dr. Vogel, if you could talk about what you've seen as to why teenagers are using these vapor products and what is influencing them or, kind of nudging them in that direction.
Sure. It's really helpful to hear from Lacey and Landon about what you're seeing firsthand on the ground. And that does track with what the research shows also. You both brought up social media, and a lot of my research has focused on how social media, particularly tobacco-related content, influences young people and their behaviors. And the short answer is that it influences them quite a bit. Social media has a way of kind of glamorizing things. When we're on social media, we see just the highlight reels of other people's lives. So if somebody is vaping on social media, they're making it look fun. They're at a party or they're just hanging out. You're not seeing the other things that are going on in their life or what's going through their head. You're just seeing that they're having a good time or they're relaxing and that this vape is helping them to do that. You also both brought up the idea of looking cool. And yes, as vaping has become more and more popular, that's become more of an issue too, the sense that everyone is doing it. One other reason that I like to bring up is sometimes underlying stress or mental health concerns can also prompt vaping or make vaping worse. So I think addressing the underlying issues can be important too. For a lot of kids, it is that they want to look cool or fit in, but some kids are using nicotine to try to reduce stress, and it's important to address those underlying causes as well.
Yeah, we also know, there's research out there that shows that nicotine, if you have an underlying issue, often makes it worse or can increase that anxiety. Dr. Cohn, I would love for you to touch on some of those mental and physical health risks associated with young people. We know their brains are still developing in their teen years. What are some of those effects, and what do you think, what kind of educational messages would be helpful in trying to influence teen behavior?
Yeah, I think Dr. Vogel and the rest of the people who've spoken already have really hit on the fact that we do see, individuals who use nicotine and tobacco products overall, and vaping is, the product du jour, tend to have some underlying vulnerabilities. And what we see actually with our own data, we've collected with over 1,000 youth in Oklahoma, is very similar to what we see in older generations with cigarette smoking, that youth who report vaping in the past month are more likely to have depression, are more likely to have anxiety, they're more likely to report using alcohol and cannabis and other substances. So I'm not saying that one necessarily leads to the other, but if we can address some of those underlying vulnerabilities, like Erin was saying, perhaps with some messaging that, using nicotine vapes is actually not going to improve your mental health. It might, in the moment, make you feel better, but in the longer term, you're going to see those symptoms get worse if you continue to use chronically. I think that that's a really important message to tell people. It might look cool now, but a few years down the road, if you want to quit, it's going to be a lot harder to do, especially if you don't already have those coping mechanisms in play for yourself. And I also just kind of want to touch on another thing that Dr. Vogel said about marketing. Tobacco companies are really smart about marketing their products to appeal to young people and to their consumers in general. And if you look at some of the content and descriptors of marketing, they use words that appeal to people trying to improve their mental health. So, products that impart some sort of experience or concept that is exciting or spirited or fun. Kind of conveys a message to the people using these products that if you use this product, you're going to feel good and happy. And so I think improving how we work with, policy to change the way these products are marketed can also help reduce some of those misperceptions of harm associated with these tobacco products.
Thank you. Yeah, we know there have been, legal rulings. There are currently corrective statements up at gas stations and tobacco retailers across the country that are highlighting that the tobacco industry with cigarettes lied and engineered their products to be very addictive. And we know big tobacco is also getting some market share with these vapor products. And so those allegations around cigarettes have been proven. And I think, what sometimes resonates with my teenager is buyer beware. No business industry is going to have your best interest in mind. So with that, Charlie, I'm wondering if you could talk a little bit about what we're seeing with our rates in Oklahoma and some of the policy opportunities that are out there.
Yeah, so first off, just want again thank TSET for putting this great event on. The American Lung Association is a proud partner of TSET. The good news on rates is that the numbers are down from where they were a few years ago, but they are still way too high. The Lung Association's recent State of Tobacco Control report found the percentage of high school students using cigarettes was only 4%, but when you include all other tobacco products, including e-cigarettes, that rises up to 22%, so nearly 1 out of 4 students. And so, and we're even seeing at the national level that the adult tobacco rate is increasing because the cohort of students who first used e-cigarettes a decade ago are now adults, and they're unfortunately still using those addictive products. And I think Dr. Cohn really, hit the nail on the head. The tobacco industry is spending more than 10 times what TSET spends each year marketing their products to Oklahomans. And more often than not to young Oklahomans. And so that continues to be a huge concern.
Thank you. Yeah, that's very important to point out. I know in their own industry documents related to cigarettes, they talk about children under 18 as replacement smokers. And, that neurological research shows that those neural pathways really get cemented before the age of 25. So I don't know if our researchers could talk a little bit about, developing those habits young, positive or negative, and how they have a lasting impact on your life.
Sure, I could start. There's quite a bit of research showing that nicotine, while it's addictive for everybody, it's particularly addictive for young people. And teenagers can start to develop symptoms of addiction after just a few exposures, even to tobacco products. And that's, like Julie said, because brains are still developing and those pathways are still forming. And younger people are particularly impressionable because of the way their brains are still forming. The good news, I think, about that, too, is that it can be easier to quit when you're younger, which is a great reason to quit at any age, particularly earlier on when those addictive pathways haven't been cemented quite as much as maybe they have been in adults who have been using tobacco for decades. So I think there's some scary news about that, but also some promising news for people who want to quit young. It's definitely a good thing to do.
Yeah, and I think, tried and true with tobacco cessation, quitting at any age is beneficial. And with 1-800-QUIT-NOW, the Oklahoma Tobacco Helpline, folks can get that help that they need and the coaching. And then TSET also has My Life, My Quit, which is a text-based cessation for Oklahomans under the age of 18 so that they can get that help, those coping skills. Dr. Cohn, can you tell us a little bit about why it is so challenging to quit and what goes into that?
Sure. One of the things I was going to say, in addition to what Dr. Vogel said, that I think makes quitting so challenging is not only the nicotine, is that nicotine is extremely reinforcing stimulant. And, we've heard anecdotally that individuals who have a nicotine addiction just find it so hard to quit, and it can pull you back in months and years later. The good news is that if you do quit, nicotine leaves your body very quickly. And so while the withdrawal symptoms can be kind of intense for the first week or so, they're not harmful. And, once you can wait it out that first week, a lot of the changes after that are mostly behavioral. And so I think cessation treatments really try to hone in on helping people change their behaviors and replace the positive things about smoking and nicotine with other positive behaviors. I would say particularly with relation to young people, one thing we haven't talked about is we know flavors are very appealing to young people in tobacco products. And overwhelmingly young people will initiate tobacco with a flavored product. And what we do know from the research is that if you initiate with a flavored tobacco product, you're more likely to experience a very positive first smoking or tobacco use experience. And then that very positive experience is linked to progression and escalation of use in the future. And when we see flavors, which are very enticing to young people, they know the taste of chocolate and cherry and strawberry, and so they may be more likely to try a vape if it tastes like something they're already familiar with. When we pair some flavors with nicotine, it really increases the reinforcing value and exciting aspect of using these tobacco products. And getting those two things apart from each other in cessation interventions can be hard to do. And that's one of the other reasons why it can be harder to quit, especially with these new flavored products, is that flavors, make the medicine go down better, and they make products a lot more appealing. But again, focusing on the good news is that not only do we have effective psychosocial interventions for these, but we have good nicotine replacement therapies as well. Maybe not necessarily for youth, but for adults, who can use the patch, who can use nicotine gum. So those can really help break that cycle.
Absolutely. It's so key to understanding that and unpacking how flavors play an impact. I think, some of the most popular vapor products that we see are mango. And while the FDA is waiting that out and kind of walking through that, we know that young people are using daily. I wonder, Charlie, what you're seeing across states. How are states addressing this?
Yeah, it continues to be a struggle to what is the balance of working with kids versus working with adults, and we would really like to see the state do a better job to ensure tobacco products aren't being sold to minors. So while Tobacco 21 may be the law of the land, we regularly hear from students that they have no problem purchasing products from convenience stores. So we really would like to see the state of Oklahoma step up and hold those retailers, those adults accountable for sales to minors and sales of illegal products. And I want to be clear, the Food and Drug Administration has not found any e-cigarette to be safe and effective in helping smokers quit. And they've only authorized some 23 products to even be on the market, none of which are flavored. So when you see these flavored products on shelves, those are not legally on the market. And the state of Oklahoma does have a law in the books regulating those, but there's no funding for enforcement. And similarly, late last year, the Federal Food and Drug Administration levied their maximum fines against 7 Oklahoma convenience stores for selling ELF bars, an illegal, unauthorized product. But we really need more resources for compliance and enforcement just to get these illegal products off the market.
Very good. Thank you for bringing that up. And it is important to note that these things are happening in our backyard. Representative Baker, I would wonder if you have a sense of the temperature around these policies. I know we're getting ready to kick off our legislative session, and it's a very busy time, and issues evolve over session. But, on first blush, what's kind of your impression?
Yeah, so I do know that Representative Cindy Rowe has been working on legislation. So going back to you, Charlie, and your comment dealing with retailers, her bill does deal with retailers. I do not have the final language in front of me, but it certainly is to put a emphasis or to show the list of retailers that are continually selling to youth. And so I think that certainly is a start. Representative Amanda Swope, I believe, has also filed a bill in which there will be additional taxes toward the sale of any vape products. So, I think anytime we're talking about our youth and what is best for them, people do have the tendency to want to vote on behalf of what's going to be the most beneficial to them in the long run. And we recognize that we do have a problem and some issues, and we've got to tackle those. So I think that you will be seeing some things legislatively, but I truly cannot point out enough emphasis to the fact that we have got to get not only the students, but the parents have to be educated on, where are these retail operations? I mean, where are their kids going? All of these are things that once they start kind of becoming more in tune with it, maybe some of this will slow down.
Yeah, very good point. And that's encouraging to hear that there are multiple vehicles to have this discussion go through the legislative session. I know one of the things that our state doesn't have that other states have is a license to sell vapor products. And I think that is also, a way to kind of say who has the products and how can we educate them on the rules. And definitely parents, I think it can be tricky. A lot of the vapor products may look like highlighters or very discreet products. And so we also have resources on Tobacco Stops With Me that highlight some of the popular devices so that if a parent or a guardian sees those, they can have that conversation. We know our parents are some of the most influential, our guardians, the most influential people about getting good health information to our young people. And so that's a really good point. Lacey or Landon, what do you see in your environments, or what is the general attitude around these vapor products? And do you see kids using them throughout the day? Give us kind of a lay of the land in your world.
Okay. I do see a lot of kids using them like throughout the day, like even in classrooms, like they'll be in the back of the classroom and go ahead and just vape like throughout their hoodie sleeve or wherever, and teachers don't even see it. It's not that they're paying attention, it's very discreet. As well as like in the bathroom, there's vape detectors, but sometimes like it doesn't always pick up on it, but that's mostly the main points. And definitely like after school, too, I see a lot of it, or at like sporting events. And I think that they're definitely it's definitely prevalent in schools for sure.
What would you add, Landon?
Yeah, as Lacey said, there are many students in schools using vaping products in the bathroom or just in the classroom in general. In Tennessee, I know I've seen a lot of people go out to their cars during classes to use those products instead of getting caught in the classroom. It's like kind of horrible over here with the vaping products. Yeah.
Have you, can you tell us, students, from your perspective, have you ever tried to have conversations with young people, about vaping or what sort of reasons they give? I think all of us are trying to understand is sort of where are the opportunities to help people.
I for sure have tried to talk to people in my school about it, and so has administration. Like they've made their best efforts to talk, but I think it really starts with like peer-to-peer conversations. And I've had quite a few conversations with my friends about stopping, and they usually the researchers have said they're really stressed, they're really depressed, and they think that it can make it better when it really just mutes that high for a little while. And that's some of the main reasons that I've heard. And also y'all is trying to implement a new program where we can go to not elementary, but middle schools to talk about how bad vaping is. So I think peer-to-peer and like high schoolers coming in and talking about how bad it is will kind of help and say, hey, this is not okay.
It's great. I'll throw this out for anyone on the panel. I'd love to hear all voices. What do you think are some of the specific challenges that Oklahoma has, and how do we differ from the national trend? I know, Charlie, you've got the numbers off the top of your head.
Well, I will say Oklahoma is doing a fantastic job when it comes to funding programs to help teens and help people quit. Oklahoma is one of only 4 states that we give an A grade to for tobacco prevention funding. So, we have the right programs in place. What we really, I think, need are just better laws to kind of fill some of those holes. So while we have great resources to educate kids, are we doing enough to educate those retailers who are selling the products? I've heard anecdotally that some retailers think Tobacco 21 only applies to cigarettes, not e-cigarettes. Similarly, many states have prohibited smoking indoors to denormalize the behavior. We'd like to see Oklahoma take a policy like that may not directly affect teen vaping as much, but does normalize that behavior. And again, we've really seen e-cigarettes undo decades of public health work to re-normalize a behavior. So instead of here today talking about celebrating that only 4% of high schoolers are smoking cigarettes, we're talking about the incredible numbers that are using e-cigarettes. So I want to just, commend the state has made some great progress. We have a higher than average cigarette tax. We have great protected programs through TSET and the helpline, but we do still have several holes in policy to help us, make sure we're using all the tools in our toolkit.
Can I add something to that, Julie?
Yes,
Thank
please.
you. I do want to applaud TSET because they really have given us some great policy ideas. And so that is something that we have appreciated. And just listening to Charlie make that connection, it's great to hear that we're doing something really good as far as, being able to educate, but we do have to get those policy solutions in place. And so I appreciate TSET for what they have provided to us.
So thank you. And I would ask, today, Representative Baker, you get to speak for all of the legislature. No pressure. What do you think would be helpful in educating other members? I mean, we have had some great conversations with you and some of the other bill authors that you've mentioned, but, where do you see some of the gaps, and how can groups like us or Lung or y'all fill in those gaps?
Yeah, great question. And I will tell you what really is important to every legislator is they're laser focused on their district. So yeah, oftentimes we'll take votes that deal with Oklahoma as a whole. And sometimes, people are like, well, this doesn't go on in my district, but I'll vote for it anyway. But I think if you all can make sure that you're really talking about what's taking place in their district, if there are retailers, that are, continuing to sell these products and that's been problematic, bring that to their attention. Have the youth from those schools in their district talk to them. Have the schools, the administrators of the schools talk to them. You all really just make it to where they understand what's really going on within their district. And again, I hear more of it than the average person because I hear it from school administrator levels. And so I get to hear quite a bit about all districts in the state, but some legislators, if they're not a chairman, they don't necessarily get to hear the state's focus as a whole. And so just bringing it down to their district level is very valuable.
Very good. Thank you. To kind of piggyback off of that, Representative Baker, as a educator and working in that field, what kind of support do you think administrators or schools need, and how can we or the community assist with that?
Yeah, I mean, I think it's important that the municipalities understand that when a student continues to break a rule in school, then, what they're having to do is sometimes ticket a student. Well, that becomes, an issue that they're then dealing with the family. So municipalities can work one-on-one with these schools to make sure that there is some education taking place. I know we had talked about there are some videos and things that students can watch. I know I've heard about it in my district where if they, have been ticketed and they continue to get caught, they have to go through a session of watching videos and answering questions and so forth. So there has to be some supports, though, to these schools to where there's more they can do. I loved hearing the young lady talk about, the vape detectors in the bathrooms and so forth. I mean, I hear that there are some schools doing that, some can't. But we again have to bring more of an awareness. So supports from municipalities and frankly, students that have a voice speaking out against it is almost better than any adult lecturing to these students, But there has to be more of an education around more than just the schools. Everybody in the community needs to be educated on it.
That's a really good point. Often the schools are sort of the downstream receiver of a lot of things. And I wonder from our researchers who are looking at this from why people choose to do behaviors that I would imagine they are intellectually aware are not the most healthy things. If you can talk to us a little bit about that, and what are some of the specific successful ways to help our adolescents understand the harms or successfully quit?
I don't know if you want to take this one first, Erin, or if you want me to.
Either way, go for it.
Well, I'll say I'm focused a lot on policy perspective. So again, I would say that, focus more on policies that try to reduce youth initiation by limiting access, limiting availability, and, maybe discussing local flavor bans. I know that there have been some, areas in the US that have been very, successful at that. And they have seen, changes in tobacco use among youth as a result of that. And messaging, I think, large scale messaging. And I know that TSET does this as well, to message people about, to correct those misperceptions of harm. And, I think one of the messages that we were sort of touching on this that I think is, really helpful for everybody, and particularly strikes for young people, are how tobacco companies are targeting these individuals and their vulnerabilities. So yes, they know you're a consumer, and yes, they want you to buy their product. And there's something that you can do about that, and it's not using their product. And I think that message gives a sense of empowerment. I think it's very powerful. And so I think from my perspective, those are kind of the bird's eye views of how to reduce all the noise in the environment that is, really grabbing young people to use these products without giving it a second thought about the harms associated with them.
Yeah, thank you. I completely agree with everything Dr. Cohn said. One thing I would add is that we need more research and more evidence on what works for helping teenagers quit vaping. Preventing initiation is definitely key, but we don't want to leave behind those who have already started using and need to quit. TSET has some fantastic resources. There are behavioral interventions, but we need more, I believe, to help young people who are ready to quit or not ready.
Right. I know for us with cessation, multiple attempts, it's great to be a quitter time and time again, but those are all practicing for that quit attempt that will be successful, and you learn something from each time. One of the things that we've also noticed with our work is, and maybe our young people can speak to this, sometimes you are having to help teenagers understand that they need to quit something, that repeated use of a vapor product throughout the day is an addiction. I wonder, Lacey or Landon, if you could speak to that. Do you think that the teens in your world are aware that they, need that vape and are dependent, or is it just, not something that is on the top of minds right now?
I'll let Landon take this.
You're at school. The bell is ringing. That's okay.
What was the question again? I'm so sorry.
Nope, absolutely. A lot of times what we see is that for our teen audience, we have to remind them that using a vapor product throughout the day equals addiction and something that you might need help with. Mm-hmm. In your world, do you see that teenagers are aware that they are addicted, or what's your perspective?
Yeah, I think that many teenagers know that they are addictive. I've actually, in fact, heard people come to me and tell me hey, I'm addictive, I need help. And also me personally, I'm gonna bring my personal story to this. I also went to vaping and everything. I have started using nicotine and it was really hard. I had told myself that I am addicted. It went on for a couple of months and I've told people about it. But coming from my personal perspective, it's not that we need it or it's we want it. We want it always by our side. You know what I mean? Mm-hmm. It's just something that we need to get our mind off of whatever is going on.
Yeah, that's a really good point. And thank you for sharing your personal story. Very brave. And thank you for your work on that. I don't know, Lacey, if you would have anything to add, or are you in the middle of passing period waiting for the next bell?
I can go ahead and add to that real quick. Sorry about that.
No worries.
I think it varies from student to student. Some people definitely know that it's addictive. Most people do, but I think that some people, I've heard from some of my friends, that they really don't understand that they are addicted until they have to have it every 5 minutes, or they have to have it every passing period in between school. And they don't care about the risk of getting a fine for it or getting it taken away. They just have to have it. But some people definitely, as Landon said, do know that it's addictive.
Great. From any of the panelists, we do have a law in Oklahoma now that has changed that allows judges to oversee when young people are ticketed for possession of tobacco. From anyone's experience on this panel, and I know we've got a lot, is that a useful way to talk to people about addiction? Have you seen that play out well, or is that just kind of the thing that gets people's attention and hopefully you can move them to a path of getting help?
I could start. I think especially with young people, it's important to not solely present vaping as a disciplinary issue and not to only approach it that way. That's not to say there isn't a place for disciplinary action and setting boundaries and making rules clear around not vaping. But like I said earlier, I think getting to the underlying cause is important too, whether that's stress, anxiety, depression, peer influence, easy access to vapes, all sorts of things. So I think just listening to teenagers who are struggling with this is really important too, because we can look at, especially as researchers, what is happening on the national level or the state level. But when you're working one-on-one with somebody, it is important too to listen to them. So there is a place for discipline, and I think it can be helpful as long as other approaches are taken too.
Yeah, that's a really great point. Thank you. One of the things that we're also seeing come about in our state is other nicotine products. So that might be mints, toothpicks, or the pouches. Can anyone on this panel, maybe Charlie, you want to kick it off, talk about how that those emerging products are changing the landscape and how youth may fit into that?
Yeah, it's really interesting because cigarettes are now the third most popular product among teenagers after e-cigarettes and cigars. And so we're seeing tobacco companies come up with these more novel products, often advertised as tobacco-free, or obviously usually with some nice flavorings, to really kind of create a new market. I think they've realized that they've lost the battle on cigarettes, thanks to the work of everyone here, and so they're coming up with these new products that not only kind of skirt some pre-existing notions about their dangerousness, but also skirt laws. And so, in many states, there are restrictions around, for example, where you can advertise tobacco products. Those don't apply to e-cigarettes or these newer products that don't have tobacco. And so we're really seeing in many states a concerted effort to carve out new laws, carve out new policies, and carve out new ways to sell products for these newer products, particularly to skirt existing regulations, and kind of going off of the idea that, hey, we're not cigarettes, so we're not dangerous, as opposed to, we're made by the same people who make cigarettes, we're just coming in a different form.
Very good. And I want to be sure that we're highlighting, because I know many of us work in this world and we kind of have a shorthand, but cigarettes are the most harmful way to consume nicotine. There is no safe level of exposure to secondhand smoke. And so I'm wondering if our researchers could touch on some of the physical harms of vapor products.
I can go first if you'd like. Yes, that's so important. Vapor products, even though there's no combustion, no burning involved like cigarettes, they're still really harmful to our respiratory systems. When we're putting anything in our lungs that is not just air, that's going to be harmful. Our lung tissues are very delicate, and we're still learning about the long-term harms of e-cigarettes because they simply haven't been around for decades and decades the way that cigarettes have been. But there is some evidence that they can cause even very serious lung injury. Those cases are more rare, and a lot were linked to cannabis vaping rather than nicotine vaping. But they can even put young people in the hospital with severe lung injury. So we do see that. Nicotine itself can also raise blood pressure, increase heart rate, cause these cardiovascular effects that long-term could be harmful. There's some evidence too that vapor products may promote cancer. Again, a lot of this is newer research that we're seeing, and we need more kind of population level, big picture data on what these products are going to do long-term. But the evidence short-term is that they are still harmful, even if they're not burning tobacco like cigarettes or cigars are.
Yeah, and I'll add to that, if we think about the multitude of behaviors related to tobacco use, especially among, youth and young adults, it's not often that we would see a youth only using e-cigarettes. They may use other products as well that are combustible. And so when we see those go hand in hand, we don't necessarily see the harm associated with e-cigarette use necessarily, being reduced if somebody is still smoking cigarettes, but maybe just fewer cigarettes because they, are vaping a little bit more. And so, dual use and poly use of tobacco products is also something to think about when we think about, vaping in general. And then, the other health behaviors that go along with it. Dr. Vogel mentioned cannabis. We know cannabis vaping has, almost tripled and doubled among youth in the past 5 years or so. And cannabis brings with it also many similar toxicants and carcinogens as tobacco smoke. But we're really in the infancy of our research to understand what the short-term and longer-term health impacts are, both in terms of respiratory symptoms, but also in terms of cancer risk.
And Julie, if I could just add on to that, also with e-cigarettes is the amount of nicotine in the level of addiction. A pack of cigarettes, that's 20 individual cigarettes. We're seeing e-cigarettes that go for about $20 that have up to a carton or more of nicotine in them. And when you think about how they're used, traditionally you'd have to, if you're a high schooler, sneak outside to smoke a cigarette or wait till after school. You're now hitting a higher nicotine content device regularly throughout the day as your brain is growing. So in addition to the health concerns of what this is doing to your lungs, there are still incredibly concerning questions about what kind of addiction this is going to create for our younger generation.
Absolutely. And I know anecdotally, I hear stories of folks, talking about maybe they've switched to an e-cigarette device, but they're using it throughout the day, where they used to just take a handful of cigarette breaks, and that making it even much harder to quit. And I think that's a really good point. Thank you. We have a question for our young people from our Facebook viewers. I would be curious to ask the high school panelists if a young person, maybe a peer leader or somebody who's cool, was championing the fact that it's not cool to vape. Do you think that would influence your peers? And would we expect to see change? Because as we've talked about, and I know Representative Baker from her time as an educator, teenagers want to make their own decisions, and sometimes adults telling them what they should do is not always as effective as peers. How effective do you think it would be to have peers championing not vaping?
I think it would actually be very effective. Right now in my school, y'all is one of the leading programs for to bring awareness to vaping and how bad it is. And we have quite a few people in there. I don't necessarily call myself cool, but I am one of the advocates that does preach don't vape, like it's bad. And I think definitely if your friends will start preaching like that vaping is bad, somebody that you care about, I think is the most important person that could get through to you, just in my personal opinion. I definitely think that is the most sure-through way to get somebody to quit vaping. Like, hey, I care about you. We know this isn't good. Like, you should quit it. And I think that would be one of the best ways to do that.
Great. Thank you. So we're coming up right about an hour. So I will ask around the horn some kind of final thoughts and comments. And I'm going to start on the top left in my screen, which is Charlie. Next up would be Dr. Vogel.
Well, I just want to thank TSET again for hosting this, and just want to be clear that the inhalation of harmful chemicals, which e-cigarettes are full of, can cause irreversible lung damage and disease. And the Food and Drug Administration has not found any e-cigarette to be safe and effective in helping smokers quit. And in fact, they've only authorized some 23 products to even be on the market, none of which are flavored. So it's going to take a community to address this problem. We've let the cat out of the bag. But I really appreciate this group today talking about this and identifying some solutions.
Dr. Vogel.
Yes, thank you for having me. I've learned a lot too, just by listening to everybody. I mentioned that my research is largely on social media and how that influences young people's tobacco use. And there are a lot of negatives there, but social media can also be a positive vehicle for change. We do see interventions delivered on social media that can be effective, largely because teenagers are already on social media all day, so we might as well use it. Something that Lacey said made me think too about the idea of influencers and using them for public health purposes. Some influencers on social media have partnered with organizations like Truth Initiative to promote anti-vaping messages, and that sort of social influence can be really positive as well.
That's a really good point. Their technology is there. We can leverage it for impeding or promoting. Lacey.
This has been an amazing opportunity, and I have learned a lot through this panel. And just a thing, just to sign off, is vaping is a problem in our schools. And I think that the best way that we can mediate that is to have peer-to-peer conversations and educate people in the community and in the Capitol directly from the students about how bad this is. Like Representative has said, the students are the best way to talk to people in power about this. Thank you.
Excellent. Landon.
I would just like to thank everybody for this opportunity. Thank you guys for having us here. Yeah, y'all, our TSET, or all of you guys have made me feel like I've been heard, kind of. You guys what you guys are doing is incredible. I love that you guys are trying to help younger people, because there was a moment in my time where, you know, I didn't feel heard. I wanted to quit, but I couldn't. And with y'all's organizations and whatever you guys are doing, I feel like, you know, I can do something to stop this, and I can help other people.
Well said, Landon. Thank you. That's very heartfelt. Made my day. Representative Baker.
Well, thank you so much. I will say that it's very important as a policymaker to hear from the constituency. I love it that we have made the connection to where these youth understand that their voice matters, and they need to bring to us potential policy solutions. Again, we'll continue to work with TSET, and I greatly appreciate the policy recommendations that they have sent forth. But ultimately, again, it goes back to we have to hear from the people, and we've got to educate. It is a reciprocal issue. They've got to educate us on what policies will be important to making a difference, but we've got to also educate them on the dangers of what we see right now with vaping. And I will say additionally, and we have talked about it today, but mental health is such an important topic, especially with our youth. And if vaping, and of course the cannabis vaping that has increased, if that can, we need to talk about that and the correlation that it has to mental health issues. I think that, everyone understands that, and they understand the suffering they see with our youth and mental health. So the more connections we can make to some of that through education, the more valuable it will be to ending some of this. So thank you.
Excellent. Yes. And Dr. Cohn.
Yeah, it was such a pleasure to be part of this amazing panel. Thank you so much for including me. My closing thoughts, which, just to add to what everyone has already said, because this is a multi-pronged issue, is that, tobacco companies are really nimble. They have a lot of money, they have a lot of time, and they seem to have fewer oversights than us public health officials. And I think everybody's, on target by thinking about the best ways to combat tobacco company messaging and targeting through, public health campaigns, working with, local governments, working, on the ground in the schools, and then doing the research to inform Food and Drug Administration policies. And that research is really needed for the FDA to make their decisions and for those decisions to stick, because unfortunately tobacco companies will take them to court for the policies that they enact. And so the more work that we're all doing to inform what are the potential consequences of vaping and tobacco use, particularly among youth, will definitely help make that case when FDA has to set new regulations. So for Lacey and Landon, if you're interested in research in the future, that's a great way to make changes and to kind of keep this moving forward in a positive direction.
Absolutely. Well said. Well said. Thank you. And panelists, thank you again for all of your insight. We really appreciate your time and your willingness to share your knowledge so that we can talk about this important issue that is facing Oklahoma youth. We'd also like to thank our viewers who took the time to join the conversation. Hopefully there are nuggets that they will take and use and continue to educate and advocate in their communities. As we've heard these panelists say, this is a complex issue. It's about seeing what your peers and your friends are doing. It's about policy. It's about education and parents and guardians understanding how to steer their young people. It's about lawmakers and giving them food for thought and helping them move things down the road. So if you want to make a difference, I would encourage you to talk to your state and community leaders about ways that we can work together. And if you'd like to get more information on TSET, please visit our website at oklahoma.gov/TSET. You can also follow us on social media. This will be on all of our social media channels, so you can take it and share it. To learn more about the critical work of our panelists,